Hello friends, in this presentation I am going to present a brief overview on FDA approved medication for diabetes, specifically focusing on a class of medication called glucagon-like-peptide 1 receptor agonist. It is also known as incretin mimetics. Before going to the drug, I will start with burden of disease and unmet needs. Diabetes is a common chronic condition affecting around 8.5% of the global population as well as near 9.4% of the US population. This condition, along with its frequency or its commonality, it is also associated with significant morbidity and mortality. In fact, diabetes is a major cause of blindness, kidney failure, heart attack, stroke, as well as lower limb amputation. As per the recent estimate, diabetes is attributed to nearly 1.6 million deaths as of 2016. One of the major goals of diabetes treatment is to control HbA1c, which is also known as to have glycemic control. Achieving sugar level or achieving, which is measured by HbA1c, is associated with significant reduction in micro as well as macrovascular complication, and therefore the primary goal or the major goal for the treatment of diabetes is to achieve therapeutic goals in terms of having appropriate glycemic control. However, as per the recent estimates on epidemiological data, from the epidemiological data, it shows that studies have shown that nearly 27 to 55% of type 2 diabetic individuals fail to achieve therapeutic goals. Therefore, there is a huge unmet need to improvise diabetes management in the United States as well as globally. Recently, in 2017, FDA approved a drug called Ozempic, which is the brand name of Semaglutide. This drug is recently approved GLP-1 receptor antagonist, which is manufactured by Novo Nordisk Pharmaceutical, and it is indicated for the treatment of type 2 diabetes adjunct to diet and exercise. This drug is available as an injectable formulation as of now, and it is administered through subcutaneous route of administration. The dose of this drug is people with type 2 diabetes are initially started with 0.25 milligram once a week dose for the first 4 weeks, and then they can increase the dose up to 0.5 milligram once weekly after at least 4 weeks of treatment. This drug has a great value because it has not only achieved the preliminary outcome of having appropriate glycemic control based on phase 3 randomized control trial as compared to placebo, but this drug is also associated with improvement in weight as well as has demonstrated cardiovascular benefit. Along with these two benefits, once a weekly regimen provides flexibility and may be associated with high adherence. On the downside, as Another available GLP-1 receptor and agonist in this category. There are some common adverse events, and these common adverse events include nausea, vomiting, diarrhea, abdominal pain, and constipation, which occurred nearly 5% or more than 5% of patients receiving this drug. And this drug carries a black box warning for thyroid C tumors, which is also consistent with entire class of GLP-1 receptor. Now, if we look at the history of GLP-1 receptor agonist, within the class, the first GLP-1 receptor agonist was approved in 2005, and since then there has been 5 approvals of different GLP-1 receptor agonists from different pharmaceutical companies. In 2010, liraglutide was approved, which was also manufactured by Novo Nordisk, and because of its benefits on weight loss, there was another brand called Saxenda, which was utilized to reduce, or which was indicated for weight loss, which was approved again in 2017. Along with that, GlaxoSmithKline, Eli Lilly, and Zealand Pharma also received approval for the GLP-1 receptor agonist subsequently in 2014-16, and the recent one is in 2017. And there are 3 drugs under the same class which were under investigation. However, one GLP receptor agonist called Semaglutide, which was manufactured by Roche and Ipsen collaboration. This product didn't reach to phase 3 clinical trial because of serious gastrointestinal toxicity. And currently, Semaglutide is under FDA reviewed, which is also an oral version of currently approved Semaglutide, which is known as Ozempic. As of now, as you can see, Semaglutide will be the first oral glucagon-like-peptide receptor agonist, and which will give flexibility and freedom from daily or weekly injection, and this may serve as a broader value story from GLP-1 receptor antagonist class, that along with the similar benefits, it offers the oral administration, which is more convenient route of administration. And there is one more drug from Sanofi and Inami collaboration, which is under phase 3 clinical trial under investigation. If we look at the history, not only from the benefit but from the risk perspective or from the adverse event perspective, we should be aware of certain adverse event of this medication while prescribing or utilizing this medication. Earlier, when the first GLP-1 receptor antagonist was approved, exenatide in 2005-6, as of October 2007, there have been 13 post-marketing reports on acute pancreatitis, which was probable causation with the use of exenatide. Subsequently, 6 cases of hemorrhagic or necrotizing pancreatitis were observed, which was a probable cause of this drug. And subsequently, label include information on the risk of altered kidney function. Similar kind of adverse event has been noted from the entire class from for incretin mimetics, and therefore in 2014 there was a joint statement on for FDA and European Medical Agency regarding possible risk of pancreatitis with this drug, and therefore this drug may causes pancreatitis, and routine monitoring for this condition is advisable for the patients taking this medication. Along with this two data on the pancreatitis and acute kidney injury, there is also black box warning for thyroid C tumors, which was observed for on the basis of animal data. There have not been any clinical data on this association as of now, but and as a result of possible association with thyroid C tumors, FDA had a black box warning for the entire class of medication that it is not indicated it is contraindicated in patients with multiple endocrine neoplasm syndrome type 2. And all of this medication as per the product label do not include data on benefits on microvascular outcomes. So this is basically to understand, this presentation was basically to understand the history of GLP-1 receptor agonist and understand the value proposition in terms of benefits and safety concern. With this, I conclude my presentation. If you like my channel, please do subscribe, and if you have any question, please leave it in the comment section. Once again, thank you very much for listening to my presentation. Thank you. Have a nice day.